Yes, friends, good morning, everybody. Again, so welcome back to our discussion about anatomy physiology. Today, the subject, another system we'll discuss is the genital tract or reproductive system. Most of you know the organs of reproductive system. When we come to the organ of reproductive system, now we have to specify whether it is male or female. Until now, we have not differentiated between male and a female in all the 8 systems. You have seen in endocrine system, digestive, heart, everything is almost similar, although there are minor differences or some differences anatomically between male and a female, but not as such radical. But here there is a radical differences. So now in male and a female, so first let us discuss about the female genital tract. It is very simple, gentlemen. So in female reproductive system, there are 2 ovaries, okay? 2 ovaries in the body, in the pelvic cavity, and above these ovaries, there are funnel shape, there is a tube, that is a fallopian tube or Sulfinges tube, and they open into uterus, and the neck of uterus we call as the cervix. Cervix opened into the vagina and the external genitalia. Okay, external genitalia where there is a clitoris, mons veneris or labia majora, labia minora, and vulva, the outside opening. So these are the organs of female reproductive system. But add one more, breast. Breast is also part of female reproductive system. Without that, you are not sure what is there. But a fully developed breast is a signal that the inside part of the female reproductive system is very well developed and healthy, and there are no diseases. Okay? And in male reproductive system, what are they? Very simple. So there are 2 testes situated in a house, in a scrotum and hanging. And this God has not hanged them outside and you have to protect when you play the cricket. Because remember, spermatogenesis is affected if the temperature is more. So those who work in coal mines or these places where near furnaces, or cooks where the body is exposed to high temperature, in them the process of sperm production is affected, and they may suffer from infertility issues, or there may be oligospermia, less count, or defective sperm and all that. So there are 2 in the house scrotum. In scrotum there are 2 testes, and when a male boy is born, a doctor will check it that both testes have come out or not. So because they come out after the during the birth. In embryonic life they are in the abdominal cavity, but when they come out through inguinal canal, they come out. So the doctor has to feel it. Otherwise, sometimes they remain inside. Okay, they call undescended testes or cryptorganism. When inside there are sperm, and the boy will suffer from infertility. Okay, so 2 testes. From testes now, there is a testes upper part we call as epididymis, and then this goes up and attach sperm. They are manufactured in testes. Okay, and now in between, before on en route, there are glands. For example, there is one seminal glands. There is a prostate gland, so they add prostatic fluid and the liquids, they add it so that the sperm can survive, they can swim, and they give them an environment or the media to remain healthy, active, living, and also to float. Okay, and then this opens into the urethra, and urethra is nothing but this runs through the penis. So this plus external genitalia in female, in male, that is penis and the scrotal sac. Okay, so urethra, and through urethra the sperm are thrown out. Okay, remember in male there is only one opening, both for urine and for the sperm ejaculation, both in the one route, but in female there are two. Okay, so these are the organs. The function of reproductive system is simple. That is, the one is the progeny, or having another generation, producing another generation, and next is also the pleasure also is very important. That is why people use this system quite frequently. So this is about reproductive system. So the diseases, now coming to that. Okay, infertility is one. Okay, uterus is uteritis, vagina vaginitis. Okay, fallopian tube is salpingitis. Okay, ovary is oophoritis. Okay, testis is not testitis, but it will be orchitis. Orco is a prefix for testis. So orchitis. Okay, prostate prostatitis, urethra urethritis, and penis inflammation is balanitis, B-A-L-A-N-A-T, balanitis. So these are the diseases. From the point of drug treatment, as a medical representative, there are very special class of drugs now marketed. World's almost number one top drug which was there. This for erectile dysfunction, the sildenafil citrate, and then tadalafil came. Very important drugs for you to promote for erectile dysfunctions in female. So many, hormones and anti-infectives. Actually, God has made this system as such, more exposure to the outside environment, direct contact. So the urinary tract infections, remember, are more common in females. Okay, otherwise also the anal opening and vaginal openings are very close. So they don't know, or sometimes due to unhygienic way of cleaning, the feces can go into the vagina and there can be infection, quite common. So infective conditions are one of the, for antibiotic, for gynecologist, and for there is no best indication than reproductive system indications or genital tract indications. Okay, male relatively less, but anyhow there is no much difference because both are interconnected. If female have infection, she will give to the male also. Whether it is a sexually transmitted disease like gonorrhea and others also, this AIDS also is one which is which is part of STD, but there are other route of administration also, like infected blood and all. Okay, so friends, with this in our video today, we complete our discussions about anatomy and physiology. Please refresh it, read some books. Your training manager will help in your company, but as a medical representative, you should know the different systems and the diseases and the organs, because it will give you more confidence when you meet a doctor. Okay, so thank you very much. Have a good time.